I'm just curious, what drew into being into a pediatric intensivist, or why are you into pediatric intensivist care?
So I knew that I had this passion for caring for children, being with them, teaching them.
You've also launched a program called SETME, if I'm right. Yeah.
Yes.
Could you please elaborate on the program?
So I believe that when you teach a child, you teach a family, basically. So it kind of empowers the entire family.
You have heard of all these parent misconceptions like vaccines are not good for children, or if you give them some cold foods, basically it will catch cold for the children.
ಇಲ್ಲ ಇದು ಕೋಲ್ಡ್ ಫುಡ್ ನಾವು ತಿನ್ನಬಾರ್ದು, ಇದು ಹಾಟ್ ಫುಡ್ ಇದು ತಿನ್ಬೋದು ಅಂತ. We don't have complete awareness or knowledge of why those people used to say certain things and why.
Given a statistics of every 33 seconds there's one cardiac arrest which is happening.
Almost 1,000 people in a day get cardiac arrest across the world, which is a big number.
Any other few milder symptoms which are indicative of cardiac arrest before the person actually goes into cardiac arrest?
There are classic symptoms of a heart attack, and we know that many of these heart attacks lead to cardiac arrest.
Hello everyone, welcome to Namma Pulse, powered by Vaidyo, India's largest healthcare job portal. I am Dr. Chetan, I am your host today. We bring health innovations, healthcare technologies and practical medical knowledge to your doorsteps. Today we have our guest, Dr. Supraja Chandrasekhar, who is here with us today. I am your host, Dr. Chetan. Dr. Supraja holds a bachelor's degree in medicine and is a member of Royal College of Pediatrics and Child Health in London, and she's also completed Pediatric Critical Care Fellowship and from the Indian Academy of Pediatrics, where she's the topper, of course. And welcome, Dr. Supraja. Welcome.
Thank you so much. Namaste. I love being here.
Before we dive into the actual topic of basic life-saving skills everyone should know is today's our topic, as you know. I'm just curious, what drew into being into a pediatric intensivist or pediatric intensivist care? Why are you into pediatric intensivist care?
Okay. I don't know. I think it's in my DNA to be with children. I absolutely loved it. From the beginning, from when I was very young, I remember with all my cousins, getting them in line, teaching them things. It used to just energize me. So I knew that I had this passion for caring for children, being with them, teaching them, etc. So then it grew on to my love for being a teacher. Finally, when the PUC results were out, I was thinking, should I really do medicine or teaching? And then my father says, do both. And very few people have that, opportunity. And I think that was the most significant career turning point for me. And being a doctor, I'm privileged to have some teaching skills. And that too, being with children, it's amazing.
Yes, that's very good. So, what inspired? I also heard that you are into kids teaching, and you are also conducting some first aid teaching programs in the schools and institutions, particularly. What was your passion about teaching into that, or how did you manage to do that, being a pediatric intensivist, which is always like an intensive care for you throughout the day?
That's right. As I said, these community programs actually bring a lot of connect between what we do in the ICU to the purpose why we are doing it. Ultimately, our purpose is that children should not fall sick. And if they do fall sick, how quickly can we get them get
You
better?
have also launched a program called SETME, if I'm right. Yeah.
Yes.
Could you please elaborate on the program to us?
Yes. So SETME is SETME, which is Student Empowerment through Medical Education.
That's a nice word.
Yes. So it all started 10 years back at my rather formative years of being a pediatric intensivist. I felt that we need to actually train the community for basic life support or lifestyle management, all in children. Why we decided to do it in children and not in adults are, children are very receptive. And they can adapt very easily. They're very inquisitive and they learn new things far better than adult. Adult learning behavior.
Yes, you try to inculcate from the childhood itself. Yes.
Exactly. So I believe that when you teach a child, you teach a family, basically. So it kind of empowers the entire family. So we started teaching basic life support emergency life skills, like what to do if there's a snake bite or a dog bite or anything like that.
Basic life support is, I think, a very important aspect in the West, which we generally try to neglect in Indian culture.
Correct.
Probably in the form of education. We,
Yes.
like in the earlier ages, they used to impart it from our grandparents. They used to generally teach us in other concepts.
Yes.
But I think basic life support is just the need of the hour today.
Absolutely. It has not got the importance it deserves. And it kind of is between core medical practice, whereas it is neither part of a school curriculum. So it's lost somewhere in between. And that's where nobody really knows it. So we thought, why not take it to the schools? Take it to the schools before they finish their schooling. So the 9th and 10th program. In fact, CBSE has a wonderful program called Seva, under which we try to do it. We've done it in so many schools in the last 10 years. And the feedback is absolutely amazing, because these children say, we love it. We know that we can make a difference as a child. And I always tell them, go back home and teach your family and spread the word. So let's see, a little drop makes an ocean.
Correct. So apart from your expertise in BLS and teaching children, you are dealing every day with kids, and kids as patients particularly. So just going apart from our regular talks, so what is the funniest thing have you come across with your young patients?
I have so many little things that I can think of. Yeah, but one of the most sweetest thing which came very spontaneously was when a little child, it was a little boy, and he was calling my nurse as auntie, and he was calling amma and appa and everything, and he looked at me and I called akka. I was so happy. I was like, I want to record this and take it home. And the parents started laughing, and then they asked him, ಯಾಕಪ್ಪ ಅಕ್ಕ ಅಂತ ಹೇಳ್ತಾ ಇದೆಯಾ? ಇವರು ಅಕ್ಕನೇ. And then they said, ma'am, you must be very young. And I said, no, not really. I'm quite old. And then, young, old is just a parameter. It's just in context. So then she said, how come? Then I said, see, when you make yourself so busy, you don't have time to get old. And that's what children do. They keep you young. So I think that's something I'll always cherish.
That's adorable. So one more question I have. I think anybody would ask you. You have heard of all these parent misconceptions, like vaccines are not good for children, or if you give them some cold foods, basically it will catch cold for the children. So do you want to talk anything or elaborate on parent misconceptions of the older terms what we have?
Yeah, I think these superstitions and beliefs are very much part of our tradition, and the way
it's being the part and parcel of our basic tradition of the culture what we have. Correct. Being an intensivist, being in the ICU all the time. So you please tell us.
I find a lot of positive things in our Indian culture, which our ancestors bring, especially the type of food that we eat. There's so much of thinking in how they have, made our meal plate in our previous generations. But we don't really follow all that. We just pick things that ಒಂಥರ ಮೂಢನಂಬಿಕೆ, we say, ಇಲ್ಲ ಇದು ಕೋಲ್ಡ್ ಫುಡ್ ನಾವು ತಿನ್ನಬಾರ್ದು, ಇದು ಹಾಟ್ ಫುಡ್ ಇದು ತಿನ್ಬೋದು ಅಂತ. We don't have complete awareness or knowledge of why those people used to say certain things and why. Coming to the first aid concept, this really affects us as medical people when parents don't do the things which actually a child in an emergency requires, but because they watch probably serials or what their ancestors did, they think that is the way to go. Nobody has even taught them. For example, if a child has a fit or a seizure and is, actively seizing, many parents even now tend to hold the child to prevent it from moving, tend to put things in the child's mouth to prevent the tongue bite, give them a key, etc. None of this makes a difference. Okay. All we need to do is to make sure the child doesn't aspirate his own saliva, and we need to turn the child to the side. This simple thing can actually benefit the child a lot, but parents don't know. Nobody's even taught them.
Since you have started this seizure thing, so I want you to, can you just give a 2 minutes of explanation on how to exactly anticipate or probably help a child who has had the first term of seizure or at the initial stages, when they come across a seizure which is happening, like a seizure probably.
Absolutely.
How do we address it?
Seizure is called as fits in common language. We see children who, have that really jerky movements. They go this way, they have that very jerky movements all over the body. The child falls unconscious, usually falls to the floor, and they keep jerking. Now, for a parent to see a child jerking like that, especially where the jaw moves in one particular direction, they clench the teeth and the tongue gets bitten,
Correct.
They feel very helpless, and it's their reflex to go and open their mouth to allow them to breathe and to prevent the tongue from getting injured.
Yes.
But that is wrong, because when they try to do that, they are in fact harming the child more. Imagine putting your fingers into the child's mouth and pushing. You will actually push the tongue back, preventing what little oxygen goes in. So that child is further at risk. Secondly, seizure is not a muscle problem, it's a brain problem. So
Yes,
because
it's
of
a
that,
neural.
by just holding the child, we're not going to achieve anything. All we need to do is, if a child has fallen down and is jerking, we need to move the child first to a place where the child doesn't get injured further. So, for example, if it is below the TV cabin or something, the TV should not fall on the child. You know what I mean?
Yes.
So keep the child in a safe place, turn the child to one side. And by doing that, we ensure that frothy saliva which is there in their mouth, when they are lying back, it all goes and at the back, and it may go into their windpipe. And that's when, yes, we have something called aspiration, where further oxygen doesn't go into them and it can damage their brain further.
Yes.
Instead, by turning the child to the side, all that frothy saliva comes
Yes.
out,
That's
and the child is in a safer place. About 90% of the seizures will stop within 5 minutes. But in case, even after 3 minutes, if it's not stopping, we need to call an ambulance, because this is going into a condition of status epilepticus, or a prolonged seizure where we can't manage it at home. That's when they need to get to the ambulance and get to any local hospital closer to them. And it's a simple injection which they give, or a spray that they give in the nose called midazolam, which can actually abort the seizure.
Okay, this would be the first dose of medicine which is to be administered to the child.
Yes, yes.
Okay.
In fact, some of the parents, where they know the child is having seizures, we give the parents the spray. They can put the spray at home itself. So we teach them. But that is only when they know. If a child suddenly has a seizure, they never had it before, all we expect them to do is see that the child is safe in the environment, turn the child to one side and wait. Most often they resolve. If they don't resolve, call the ambulance.
Okay. It's fascinating as well as scary to understand exactly what response, how our response should be to the seizures. And do you want to elaborate anything on the sudden nose bleeding, which is a very common symptom in the children? This sudden blood which is coming out of the nose
Absolutely,
in children,
Chetan.
and people panic just by looking at it.
Correct.
Yeah.
Again, in a child, even a little thing like a vomit can look so scary. I mean, it looks like the child is, aspirating all the food. So nosebleed can be very dramatic, because the nose is full and the child also gets agitated looking at the bleeding.
Yes.
So,
Blood
shall I
itself
ask
is
you?
scary.
Exactly. So what do you think you'll do? You'll pinch the nose and bend forwards, or bend backwards?
Yeah, we have to make them bend backwards, obviously. Yes.
That's what everybody does, but that's the wrong thing to do.
Yeah.
Because when you pinch the nose and bend backwards, there is a possibility that bleeding, which goes from the back of the nose, can actually go into the windpipe. And again, the child can aspirate.
Yes.
So the right thing to do is to pinch the nose for 5 minutes. It gives enough time for the clot to form, and make sure the child is bending forwards. You can encourage the child to talk just like I'm talking, even though I'm pinching my nose, and you say nothing is going to happen. We're going to pinch the nose and bend forwards. Don't keep checking if it's bleeding or not. Just pinch it for 5 whole minutes. It will stop. Like 99.99% the nosebleeds stop. And in case there is bleeding, it comes out. It doesn't go at the back. So that is the first stage to do. You are okay to put some ice, etc. later. If it continues to bleed even after 5 minutes, it may be a good idea to go to the nearest emergency. So no bending backwards, bend forward.
Yes. What might be the common cause behind this nosebleed in children?
So the nose is a very vascular area where there is a lot of blood vessels there. So anything which causes these blood vessels to become a little bigger, like heat, or if their nose is congested because of a cold, if it's very hot, if they have a fever, they can have bleeding. These are common causes. Of course, when you have certain disease conditions, when the platelets are low, etc., that can happen, but that's very rare. Common conditions are you punch the nose, the little blood vessels break, it can bleed. Or when it's very hot in summers, children do have nosebleeds.
Okay. That's a lot of information for kids, basically. I mean, we generally talk about adult health problems, adult symptoms. This we have to do for this we have to do for that condition. But we never talk about first aid in children. I think that
Correct.
is one thing which we are trying to address today. And I think one more topic which we wanted to discuss is basically the cardiac arrest or the heart attacks which are happening very often. I think post-COVID era is what people are actually linking to the increased number of cardiac arrests. And in India, they have given a statistics of every 33 seconds there's one cardiac arrest which is happening.
Yes, actually,
And-
every 33 seconds we do have a heart attack which is happening,
Yes.
and about almost 1,000 people in a day get cardiac arrest across the world,
Yeah.
which is a big number. So most people struggle understanding what is this cardiac arrest and what is heart attack.
Yes.
So heart attack is basically when your heart contracts like this. It's the only organ which keeps contracting throughout your
Yeah.
life at a regular rhythm. So it has a right part and a left part. And if one part doesn't work, the other part still continues to work. And that little part which is not working is called a heart attack. So it could be because a blood vessel to that part is gone, or for whatever reason,
Clot.
that is called a heart attack or a myocardial ischemia. In a cardiac arrest, where the heart is contracting and it just stops. The entire heart stops. So because the heart is completely stopped, there is no blood flow. And when there is no blood flow, there is no pulse. So the complete stoppage of the heart is actually called cardiac arrest.
Yeah, I think we have lost many important personalities this year
Absolutely.
through the cardiac arrest. And exactly, like since the increasing percentage of cardiac arrest is evolving or probably increasing year by year is the percentage increase what we are seeing. So the statistics also indicate to the same thing basically. So what would a normal person, a layman who does not have any medical knowledge or probably has never seen heart attacks in his life, if he is encountering a cardiac arrest, he would not be able to notice it,
Absolutely.
whether it is happening or not. So, what are the common symptoms we might look for in case if we can relate that to a cardiac arrest, or probably how do we exactly know that yes, cardiac arrest is happening at this point of time?
Yeah, I think, Chetan, you brought out a very important point. How do we know a person is actually in cardiac arrest? So let's first understand cardiac arrest. We said for whatever reason, it could be because of a massive heart attack where the entire blood vessels get blocked and so the whole heart stops. Or it could be because the electrical rhythm, instead of lub dub, it goes lub 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 dub. It goes all like an electric shock
Arrhythmias.
in that arrhythmia.
Yes.
And because of that, the heart is stopped, or for whatever reason, the heart has completely stopped. So when the heart completely stops, it's like death. There is no blood flow. And when there is no blood flow, there is no pulse. And in that situation, a person is completely unresponsive. So let's say you and me are talking and suddenly I collapse and I don't have any response. So first, we see a person who's not responding. So we shake their shoulders and say, hello, are you okay? And there is no response at all. You look at the person, there's no movement, there's no breathing movement. The person almost looks dead. So that's the first thing, finding an unresponsive person. And when you see that he is not responsive, the next thing is you go for checking the pulse. We all know that we have this little voice box over here.
Yeah.
And if we take 2 fingers and slide it down, we find that beautiful carotid pulse, which is the pulse of life. And any of us who are living will always find this pulse. Okay? So when this pulse is not felt by you, that person is in cardiac arrest. So the first C in what we call, there are 3 C's of basic life support. The first one is to identify that the person is in cardiac arrest. So we check for response by doing this. You shake their shoulders, you call out their name, you see whether there's any breathing or any movement. And if it's not there, you check the pulse. Once you know the pulse is not there, yes, the person is in cardiac arrest.
Okay. How do you differentiate between a person fainting and a cardiac arrest? I mean,
Good
both,
question.
I think the symptoms look almost similar.
Yes.
To a layman or a general common man, he would not be differentiating probably. He would, as you said, maybe our audience, if they get to know about this, they might check the pulse also, but the check pulse is on, but he's still fainting. So how do you
Yes.
differentiate between that?
So I'll just come to fainting. Good, you brought out that point. That's quite common in school children, common in young people, etc. So fainting in medical terms is called a syncope. And what really happens is when you're standing for a prolonged period of time, or where you're very emotional, or it's very hot, there are shifts in the blood flow in your body. So what happens when you stand? Your blood flow obviously is more pulled down towards your legs because of the effect of gravity. Likewise, because of emotions, hormones, not eating, not drinking, whatever may be the reason, there is more redistribution of blood to the lower part of the body, less to the upper part. So when there goes less to the upper part, at some point the brain says, oh my God, I'm receiving less blood supply. So I'm going to go into sleep mode.
Less
just like
blood
your
means less oxygen to the brain.
Yes, absolutely. Less blood supply, less oxygen, less everything. So the brain has to protect the internal organs. So what it says, just like our mobile goes into battery saver mode.
Hibernation.
Yeah, so it goes to sleep mode. And when it says sleep mode, it just switches off the consciousness or the awareness. So as soon as the brain switches off that consciousness, the patient just falls down or faints. So why did they do all this? So that the patient or the child falls down and the blood redistributes. And as soon as they fall down, they get awareness again because the blood has gone back to the brain. And then they open their eyes. Usually when someone falls, what do? We all go crowd around that person and whack them up again. But that's the wrong thing to do, isn't it? Why did the brain do all this? So that they lie down and get more blood supply. So when a person falls down during fainting, we allow them to lie down there till they feel a little better, till the blood supply is better. Sometimes when they're not yet, getting up, we actually lift their legs up so that more blood supply goes to the brain, and then they awaken. And once they are aware, they open their eyes, they see 10 people looking at them. They're so embarrassed, and then they say, oh no, I want to get up. And you say, don't worry. It's just fainting. You're okay. We'll not crowd around you. Give them some space and oxygen. Then when they're okay, we'll lift them up, ask them to sit. And when they're fully, conscious and aware, only then offer them to drink.
Yes,
but
people generally sprinkle
yes,
water.
What do we do?
Make them drink water.
Exactly.
Crowd.
As soon as we see somebody fainting, before anything, the water comes in like magic, and we whack them up. And even in that drowsy state, we put it. It's just like a cereal. We should not do it. And I guess we should take this first aid course for all the directors of all the serials, because that's where people learn, they learn all these practices from that. Anyway.
I think that's one tip you've got for the television.
Exactly. So fainting is a brief, momentary loss of consciousness. It's completely different from a cardiac arrest. It's very brief. As soon as the patient, is down, they are breathing, you pinch them, they will move, etc. Whereas, let's say someone is totally drunk and fallen on the road. He's also not responding. You go and think he's completely out.
They're in their own world.
They're in their own world, in some loka. And then, but he's breathing. Yes. And he'll have a pulse. So that again is not cardiac arrest. So when you have a person who's completely not responding to you, not breathing, check the pulse immediately. And if there is no pulse, that person is in cardiac arrest or already dead. Okay. That's it.
So any other few milder symptoms which are indicative of cardiac arrest before the person actually goes into cardiac arrest?
Yeah.
Which are indicative, like probably general, as people know, sweating, breathlessness, while walking.
I think where you're leading to is for a heart attack. Now, there are classic symptoms of a heart attack, and we know that many of these heart attacks lead to cardiac arrest. We say, massive heart attack and the person died. That is basically cardiac arrest. Today, every layman knows the word cardiac arrest because we've lost so many celebrities. It's so scary that people who are young, 40 plus is the new...
No, age, I don't think so. Age is a number for cardiac arrest or heart attacks nowadays.
I completely
recently we also came across a school child, 8th standard girl who also had a cardiac arrest, and she also passed away.
True. So A cardiac arrest can happen in an apparently well heart, which had some sudden event and it goes to what we call SCA or sudden cardiac arrest, or it can happen in a heart which is failing over a period of time.
Yes,
For example,
that was my point.
you have a kidney failure or a liver failure, heart problems, multiple problems. Over a period of time, the person is ill and they go into cardiac arrest. That is completely different story because we know this person is not doing
has
well.
ailments before in his or her
Exactly.
body, which is actually leading to that way.
True.
Yeah.
But then we also need to recognize a heart attack. Like, let's say I'm talking to you and suddenly I'm experiencing a heart attack. How would that feel?
Yeah.
Now, most people, including me, thought that heart attack is like the worst pain of your life. It's a very bad pain. Actually, it's not. Probably delivery pain is really bad pain, but
I mean,
yeah,
there's no
you wouldn't
words
know,
to it.
Chetan.
Exactly. I mean, yeah.
Yeah, but heart attack is, or the angina or the chest pain is not really a pain. It's a heaviness. It's like keeping 10 textbooks. I teach school students, like if you take all your maths books and, the entire science books and keep it on your chest, that heaviness which you feel where you can't really breathe and you're like, I don't feel good. And that's why people say gastric. That's the commonest word in
Yes,
India.
it's
They
an
say,
alternative for
exactly. Tumba gas ide, or I've eaten something.
And often
awkward.
people have been mistreated cardiac arrest or the probably
Absolutely.
not they have mild heart attacks for gastric symptoms.
Very true. And they would say, "Idu yeno agide. I've eaten too much of gulab jamun or something like that. I'm not feeling good. I'm feeling very heavy." But hold on. If it's just gastritis or if it's something that you've eaten and you're overfull, it happened to my father himself. He himself told me, I'm not feeling good. It's what I ate in the flight. But what I saw in him was he's sweating. Why would you sweat just because of something you've eaten? And they start taking very short breaths. They say like, I'm not feeling very good. And they breathe fast.
Yes.
So fast breathing or dyspnea or difficulty in breathing, sweating and feeling heaviness of the chest definitely is alarm bells. And we got to get that check. We don't have to tell the person that, oh yeah, I attended a workshop. I know you're having a heart attack. No, you just tell them, look, you're not feeling right. You're not looking okay. Let's get it checked.
Yes.
Okay. And if they are drowsy, just call the ambulance. Don't get into your car. That's when we lose people, because the difference is in the ambulance, you have a defibrillator, you have the emergency adrenaline, and those few minutes make a huge difference.
That is what we call golden hour in the
Forget
medical
hour.
terms.
Now it's golden moment. Every minute, a person who's had a cardiac arrest, every minute we lose, there is 10% further
decline
in their chance of survival. Imagine. So you lose 5 minutes, it's already 50% gone, the chance of survival. So it's very important that we recognize heart attack, because heart attacks lead to cardiac arrest. So I would say the key takeaways for a heart attack are the person feels uneasy, heaviness in the chest. There is a feeling of nausea and vomiting. This can be misunderstood as gastritis, but sweating, fast breathing, and a discomfort. They may say that their left arm feels heavy, or their left jaw feels funny, their shoulder pain. All of this can be neck pain, and they say we slept in a different pillow, and that's why we've got
this is one
all
of the
this.
most commonest other reasons people ignore.
Correct.
Yes.
So any of these pointers in an at-risk population, which is all of us,
Yes.
I guess we need to get it checked. It's absolutely fine to go to the emergency, get ECG, tropi, and whatever comes normal. It's not a waste of time. It is being responsible. So I
Yes.
think we should do it.
What are the, in case if you want to just put some medical knowledge also into it, what are the preliminary tests which will be done when they go to the hospital? And
see, the most important thing, I think most centers, especially in a high-tech city like Bangalore, they're so well equipped with what to do when people have these chest pain. They all have these ready-made packages, etc. But just from an layman point of view, I think the first thing is taking a history. That's very important. Getting the appropriate history, the past risk factors itself puts you in a different paradigm. And then we do a basic ECG. We have something called cardiac markers, which they would do as a blood test. And sometimes they would even need an echo. So the list goes on.
troponin I test.
Yeah, those are the blood tests that we do. So it's kind of, there are,
Evaluation.
yeah, there are multiple stages of evaluation, but the initial stages are what I just
ECG.
enumerated. Yeah.
And how do you differentiate between the stages of heart attack? In case if you want to just give us a common man, if or a common person, just for a common person.
Well, first of all, I'm not authorized. I'm a pediatric intensivist.
Yes.
But what I do want to say is that there is something called as a warning sign where you have angina or chest pain,
Yes.
and then it manifests as actual death of a part of your heart, which is the myocardial infarction. And if we miss that and it progresses, then the entire heart can stop. So anywhere in that spectrum, we need to pick up, preferably, as most senior cardiologists will tell us, we need to pick it up at a screening stage where we know we have a risk factor in the family. We are above 40 years. We need to do our annual screening and find out what all lifestyle changes that we can do.
Yes. Yeah. Okay. I think that's very good knowledge what you have shared to our audience. So next, we were discussing about CPR.
Yeah.
CPR is cardiopulmonary resuscitation, as we all know. So basically, we are trying to revive a patient who is had an arrest.
Yes.
So would you like to elaborate on that?
Sure.
Just a brief 3-word, 4-word, or a sentence maybe, just to remember, yes, this is the striking line. As soon as I see a cardiac arrest, yes, this I have heard somewhere, I should perform this.
Correct. So I would say, remember 3 C's of whenever we see somebody who's unresponsive. Okay, the first C is check for response and check for the pulse.
Yes.
And if we confirm that the person is in cardiac arrest, the next C is to call for help. That's where we struggle. We tend to do everything without actually calling. So all of us today itself in our mobiles should have 2 numbers. Obviously 108, we know anywhere, anyhow we can call. We have an excellent service in Karnataka where the ambulance comes to where we are and helps us out. But if we want to, we can also save the number of a private ambulance, which is close to your home. Okay. Like for example, you ask me anytime, I would say, 990 990 997 997 2074 is the ambulance number for this area. So each one can save that number so that you know whom to call when you're striking with an emergency. As I said, every minute is precious. So that's the next C, call for help. And the third C is chest compressions. So previously, we used to believe that we have to give breaths to a person and then compress the chest. But there's a lot of barriers in this, cultural barriers, and then COVID came and we have this no touch. So we realized the most important critical step when the heart stops is to restart the heart. Yes. So how can we do that? By compressing the chest from above. So that act anybody can do. And the equipment we require is just our hands, nothing else. So CPR is a beautiful thing that we can perform with our own hands without having to do anything, just exposing the chest of a person, which we can enumerate with the mannequins in a while. Yeah. So I think that's what we need to do.
I think CPR, we will have one more video completely explaining how to do it, how to do the basic life support and doing a CPR. Definitely. After cardiac arrest and the CPRs, we have got a lot of information on the CPRs. Let's continue with the first aid, other things. So there is one more important topic which we had a discussion previously, that bites, especially may be a dog bite, cat scratch, or nowadays because of the complete urbanization, snakes coming into the commercial areas, residential areas. So snake bites which are happening, whether it's kid or an adult. What's your take on this?
Yes, Chetan, I think it's extremely important. 10 years back, I never saw so many animal bites as what I'm seeing now in a busy metro like ours. So dog bites, cat scratches, and monkey, squirrel, rat, bandicoot. There are so many various mammals that seem to affect children, because now we know we have a stray dog menace, and when children are in closed communities, they often are with pets, but they are not aware what to do when their skin gets breached and the animal saliva comes in contact. So basically, we are talking about a very dangerous virus called as the rabies virus, which can spread from this animal to the child. So rabies virus, I want to set the context right, that rabies is 100% fatal disease. So it's very important that we recognize that it's an encephalitis or a brain fever which happens because of this virus, and there is absolutely no cure. In fact, we've even lost medical students who were resuscitating a child before we knew the diagnosis. The child and the doctor, we lose them. Rabies can be that dangerous. So we need to take every precaution to prevent this catastrophe, right? So let's understand that any mammal bite, be it a monkey or dog, cat, even a rodent, can actually transmit this virus. The more they are in the open or wild, the chances are much more. So we should always follow and abide by our national guidelines. We have excellent national guidelines laid down by various experts across the country. And what they say is, if at all you come across an animal bite, especially a mammal bite, then the first thing to do is to wash the wound thoroughly with soap and water. So no applying
as a
turmeric.
Preliminary aid which is given at home.
Yes, absolutely. That instantly reduces the exposure. So it's not about applying, antiseptic lotion and fancy creams or turmeric or none of those things. First thing is wash the wound thoroughly with soap and water for 15 minutes. That
15
means it's
minutes.
Yes,
That's a long time.
yes, exactly. We won't even do it for 15 seconds, but that's the guidelines.
Yeah.
You need to wash it for 15 minutes. That instantly reduces the exposure. Secondly, we need to actually understand what this exposure is. It's not just that the animal comes and bites and, creates a blood mark. It could be the paw scratching.
Yes.
So parents have told me, but ma'am, it's only the paw which is scratched. The animal's teeth were not there.
Yes.
But have you noticed
We
most
have
of the
this common practice of it's just a scratch and you just leave it.
Exactly,
It's okay. Only if it's a bite, then you have to go to the doctor.
But let's understand, we said saliva exposure, and saliva commonly is in their paw or in their mouth. So they can transmit it even by a scratch. Okay. And sometimes they say, ಇಲ್ಲಿ ಒಂದು ಸ್ಕ್ರಾಚ್ ಇದೆ ಆದ್ರೆ ಬ್ಲಡ್ ಏನ್ ಬಂದಿಲ್ಲ ಹಾಗಾಗಿ ನಾವು ವ್ಯಾಕ್ಸಿನ್ ತಗೊಳ್ಳಿಲ್ಲ. No. Let the doctor decide. The child has to be evaluated because we have 3 classes of injury. A simple lick on by a rabid dog on the skin is also class 1 injury. We need to wash it thoroughly. That's all that is required, but that's an action that we need to take. If the skin is broken or if there is a visible scratch but no bleeding, we call that class 2 injury. And class 3 is when there is actually bleeding, especially happens near the face or the ear or the hands. They are very, very dangerous because the nerve supply is more and easily the virus can transmit to the brain. So the point here is recognize a mammal bite. Secondly, wash it thoroughly with soap and water. And when it's near the eye or the face and you can't do it on your own, just go to the nearest PHC hospital. They will wash it with saline or whatever they have, evaluate the wound, and then prescribe the vaccine according to the class of the injury. So we have different types. We have a vaccine for those who have already got vaccinated. We have to give vaccines for those who have never been exposed based on the class of injury. And we may need to even add an immunoglobulin for added protection. Many parents have this misconception that if it's a pet dog or a dog
I was just about to ask you that question. I mean, that's a famous misconception or a concept probably.
Correct. That if the dog is vaccinated, we don't need the rabies
The dog
vaccine.
is already vaccinated. Why does the child needs a vaccine probably or
Correct.
an injection after that?
As we know, nothing is 100%, right? No vaccination is 100%. And secondly, there is always a confusion. Have they taken the complete course? When have they taken? Is there enough, antibody generation in the dog, etc.? So our national guidelines say, including Indian Academy of Pediatrics, that if there is an exposure, irrespective of the dog having been vaccinated, we need to vaccinate the child according to the degree of exposure.
Okay. And is there any exact difference between the degree of wound which actually leads to the number of vaccinations?
Yes.
Is there a difference?
Yes, absolutely. So we sometimes will do both an antibody which is called monoclonal antibodies or cocktail antibodies, along with the vaccination, or do only the vaccination. So that all depends on the class of wound.
It's a doctor's call again.
Yes, I think we should leave that headache to the doctor.
Yeah, and coming to snake bites, which is one of the important topics again. In snake bites, generally, the first and foremost thing which people do is panic. And
Yes.
yeah, as soon as there is a snake bite, whether it is me or whether it is anybody else, the first thing they do is panic. So, what exactly is your explanation for the first aid? Since we are stressing on the first aid, what is the first thing a person should do when there is a snake bite?
Okay, so before we go on to that, I'm glad you brought out snake bite. I think now most apartment complexes which are newly coming, the residents know the importance of snake bite, because Bangalore is already bursting full. We are just expanding and expanding into all the forest areas and the ecosystems that we shouldn't have gone, and that's why we are actually unearthing these animals and disturbing their ecosystem. So they will be there, they will be around us, and we need to be aware what to do when we have a snake bite. So once again, I reiterate, we need to follow the national guidelines. So we have beautiful guidelines. Did you even know it's called Do It Right? RIGHT. So R is reassure. So you said panic. If suddenly we are talking and a snake comes, I'm sure both of us will jump out, because it's very scary to see them. It's kind of squeezy and whatever. So why are we reassuring when we have a snake bite? Because actually 70% of the snake bites are non-poisonous. But that doesn't mean we do nothing. It's important that we calm the person down. So I just remember last week we had this child who was brought in from a school trip. They had this school trip. We are at our hospital, D is in Kanakpura Road. So we have these nice resorts around that area. So they had taken their children for a school excursion. And the child came and told the teacher, a snake bit me. The teacher freaked out and the child was crying. Now they were in a far off place, so they didn't know what to do. So they came and landed up in our hospital because it's the closest. And then the teacher was literally crying and calling the parents. Imagine the plight of the parents. They were both IT professionals and what to do. But the child was nicely talking to us. So then I looked at the wound. There was proper fang marks were there. And I asked Putti, "Yenaitu, how kachittu?" And she's just saying, "Nan torstini." And I said, that's fine. And I told the teacher and I spoke to the parents also, actually 70% are non-poisonous. So this may be a non-poisonous snake. Let's just wait and observe the signs of envenomation, we call it. There are local signs which happen at the area of bite. And there are systemic signs which rapidly develop. So the good thing they did is they just brought the child exactly how the child was. The bite was in the hand, so they just brought the child. So the Do It Right policy says the same thing. The first one is to reassure. The second is I. I is immobilize. So for example, if the bite has happened in the finger, we just have to hold the hand and bring the child, not move the hand or move the finger. If it happens in the leg, don't encourage them to walk. If you can lift the child, or 4 people lift an adult, or limp without actually using that limb, it helps because it prevents the venom to enter into the circulatory system and you're reducing the exposure. Most people try to reduce the exposure by sucking on the wound, the olden days.
Probably they
tie the tourniquet. Yes, my father keeps telling me, you should just tie that. I'm like, no, daddy, we should not do that, because if we do that, we are compromising the blood supply going there. So we know that certain snakes, like the Elapidae family, are neurotoxic. They can, they can cause severe damage in that area, or even the viper, and we can lose that limb. Gangrene can happen, and we may have to amputate. If we tie that tourniquet, we are all the more compromising the blood supply. So our national guidelines are very clear, because we don't know how tight to tie it. So what we recommend is, don't tie any tourniquet, don't suck on the wound, don't do any sort of massage or putting some paste, etc. there. All you have to do is, after reassuring the patient and calming them down, you immobilize that part. Don't make that part move. That is R and I. G and H is go to the hospital or get to the hospital. The reason we say that is, don't waste time. whichever is the nearest PHC, our government has equipped all primary health centers and community health centers with the anti-snake venom and to do the first aid. So get to the nearest hospital or a private hospital where they have something called anti-snake venom or ASV, and they will be prepared to handle this, because that drug is quite dangerous, and we need to know how to give it, and do we really need to give it? Is there signs of the poison being there? So I finished RIGH, and the T is tell the doctor what really happened. So that seems like a silly thing, but it is very important. We need to tell what all are the symptoms that happen to the patient. Did the patient vomit? Are the patient's eyes getting droopy? Did you see the snake? What happened? I still remember in my fellowship days, I came across a child at snake bite, 4 a.m. in the morning. They were these construction workers. So the child went out to pass urine, and that's when she had an exposure and she collapsed, and the parent recognized that early in the morning and brought the child. So I knew it was a snake bite, and we were just starting the resuscitation. I said, "Havinaadru nodidra hegittu?" And I said, "Howdu, madam?" And they got it in a plastic cover. I almost fainted.
They do that very often, actually.
Oh my God. I said, no, don't show me the snake. And I was like, okay, this is a crate. And, we got on to our job. So sometimes it's important to know how the snake looks. We can look at photos, etc., and describe. We have basically 3 classes, and then we can plan our treatment. So in summary, for a snake bite, it is do it right, which is reassure, immobilize, get to the hospital, and tell the doctor everything that happened.
Yes, excellent. I think most of us would be very happy to understand this and also get some knowledge on the national guidelines, which most of common people are not aware of. Definitely, they would. No, I mean, it's there in the books, it's there in the guidelines, but it should be in the reach of common people.
True.
Bringing it to common people is the job what I think government can do better at this point of time. Yeah. So continuing our conversation, doctor, I think. The lifestyle habits what we generally look at is mostly for adults, that fitness, health thing. Now there is a new concept called as biohacking. So people concentrate on so many different things to keep people fit who are adults. But since you are a pediatric intensivist, I would want to ask you, are there any lifestyle habits or lifestyle things which we should focus for kids?
I'm so glad you asked me this question. My pet project is something that we've started called lifestyle quotient for a child. We always talk about intelligent quotient, emotional quotient, and all of that. But we've never looked at LQ or the lifestyle quotient. And I think that's paramount, because that kind of determines the overall health of the child. So we look at how a child eats, how the child plays, and how the child connects with themselves, with their environment, and which is nature, and with their family. And all of this put together in a nutshell.
Okay. So what age do we start this LQ?
The LQ, it starts right from birth. So everything about how we nurture a child. For example, if a baby is missing out on breastfeeding and goes on to, let's say, formula feeding because of lack of awareness or support, that itself puts the lifestyle quotient slightly different. Or where we introduced snacking and packaged foods and how they make their meal plate and their lunchbox, a lot of things. That is about how they eat, including how they play. How much of physical activity they get and various other things, and how much of sleep and screen time and addictions. All of this describes their LQ. But coming on to the context of first aid, I think it's very important now that we are spoiled for choice. Everything, we have so much of choice.
Yes.
So when it comes to dehydration in children, I really feel sad when parents give the wrong choice of fluids to their child because they don't know, or they get fooled by marketing gimmicks and by what media shows them. So as we know, dehydration is when the fluid in our body becomes less.
Yes.
It's not water becoming less, it's fluid. So basically, it's a combination of water and the electrolytes. For example, excessive sweating due to staying in the hot sun or gymming or whatever it is, we know that sweat is salty, so we lose salts, we lose electrolytes, we lose water. So in dehydration, it's very important that we replace this fluid into our body, and it should be the same composition as the body fluid.
Correct.
Okay, it can't be something different. Now, when a parent replaces a fluid which is, let's say, very sugary, it's going to have its side effects on the child. If I give you a lollipop to suck for a long time, you're going to feel so thirsty, because the lollipop actually, draws out all the water from your tongue because of osmolar forces.
Osmosis. Yes.
Exactly. So the same thing happens when a child with diarrhea is given a sugary drink, or a so-called marketed drink as if it is a ORS with full
there
of
is
sugar.
a new drink which has come, ORSL, and I think there was a video also which had come out saying ORS is not same as ORSL.
Absolutely.
It's not a WHO formula, and then I think now they have reiterated it.
Perfect. There are so many brand names.
Flavored drinks, often they name themselves as
Exactly.
ORSL. Yeah.
Absolutely. So there are energy drinks, they come with so many fancy names, electrolyte rich drinks. It sounds itself so great and fancy and luring to the parent. And they tend to believe that. And it looks very colorful for the child rather than a boring, WHO formula. And so they tend to choose that at least my child is drinking something, let me give. But it's actually causing more harm, because of the high sugar, it has its own faults, and it actually worsens the dehydration, worsens the diarrhea if you give it. So it's important that we recognize when a child is dehydrated, there is no point giving a glucose-rich drink or sugary drink. We need to give the WHO recommended formula of ORS, and that is oral rehydration solution. And it's not that we make it ourselves with some sugar, some salt. There is a particular composition for it. We either follow that or follow the WHO recommendation. It's available both as a powder, a ready to drink flavored drink in various brand names, but just look out for that WHO. So that is what is important. Never give things like a soda or these so-called energy drinks. I just hate them for children because they are full of caffeine.
Yes.
And that caffeine actually can trigger heart rate abnormalities in a child. We actually saw a child with SVT, which was triggered because they finished their exams and she did not want to drink any alcohol drinks. So she had these energy drinks, about 3 of them. And that triggered it because there's too much caffeine in it. And she wouldn't even know. She just thought it's a harmless energy drink.
Caffeine just increases your adrenaline and heart rate. It pushes up.
Absolutely. And for a child, that's very significant. Most parents don't know that. So yeah, choosing the right ORS is very important in dehydration.
Yes, definitely, doctor. So we have spoken, I think, most of the things about first aid. Do you want to add any other things in first aid, or probably?
I think we had a good overview of what to do when a child or a person has fits, faints, is dehydrated, what fluid to give, bites and stings, as well as we covered the heart attack. So I think we've covered most of it.
Yes, we have done it. So being a pediatric intensivist, I think you have worked with a lot of organizations, headed a lot of organizations in your entire career. So what's your insight for young doctors?
Yeah, that's a good question.
Yeah.
It's not just young doctors, it's for everyone. I think you need to have a passion. You need to have something that is worth doing. I always go back to that big board I saw in Arvindai Hospital. Dr. Govindappa, he was the founder, amazing man. I've never seen him, but I've read about him. And those beautiful words that were written on that wall, it said, intelligence and capabilities are not enough. There must be a joy of doing something beautiful. So unless you find that joy, there's no point in doing anything. So I love what we do. I'm so blessed in the job that I have. And I guess that's what
when passion becomes your profession, you enjoy it.
Absolutely. Yeah.
Yeah. So I had since this program is organized by Vaidyog and it's India's largest healthcare job portal. So particularly, what career tips you want to give to the youngsters or just passing out doctors or upcoming doctors about the portal as well? If you can just mention a few words.
Sure, that's great. In today, I think we would become outdated if we don't embrace technology.
Yes.
And Vaidyog, I came to know this year when we had started our hospital and we were looking out for doctors as well. It's a wonderful portal that brings together the person who seeks and the person who needs. So it's very good, an AI generated platform that uses good technology to bring doctors, and it's a doctors only sort of medical profession only portal that allows people to seek the jobs that they want. And it allows healthcare institutions like us to get the right kind of people that we are searching for. So I guess we should all get there. And I learned from you, there are so many other benefits like healthcare
Yes,
information that gets put on and a lot of blogs, etc. Because in today's newspapers, we get so lost with potholes and with political drama.
There is no particular spot for healthcare news at all.
Absolutely.
I mean, both for healthcare professionals and non-professionals also. People who are there in the clinical aspects, people who are not there in the clinical aspects of healthcare, basically. It's very important for them to know what is happening across
around us,
healthcare.
yes. And it's just booming in India.
Yes.
We are just, I think, leading.
Yeah.
And
I just want to reiterate the fact that we compose 3.1% of the global healthcare force.
wow.
Yeah, and it's going to be 5.5% by the end of 2027 is what the statistics say.
Amazing.
Yeah. So
yeah, just being a minute part of that whole force is so amazing. And I want to check out Vaidyog all the more, but I think it's a great initiative, Chetan, and you've got some great people to even inaugurate it. That's amazing.
Yes. So yeah, I think there is one more point which actually I want to discuss, continuing our conversation, coming back from Vaidyog to Namupals again. So there is this concept of choking in children. This also, I mean, it also happens in adults, but it's more frequent and generally seen in kids. So since we are into first aid, I do not want to miss on this choking part. So
yeah, I
how
think,
would you want to just give some insights?
Sure. I absolutely agree. Choking relief is part of basic life support training as well. And so basically choking is, there is a food pipe and there is a windpipe. And the windpipe is only meant for the wind. But when a food bolus gets stuck in the windpipe and no wind can go through, no oxygen can go through, that's when you call it choking. It's not that a little bit of, food has gone to your windpipe, but you can still talk. No. Or you're coughing. No. It's completely a big bolus of food, a chunk of meat or whatever it is, gets stuck in your windpipe and there is no gas that can actually get in. So a person who's choking, it's dramatic. It happens within seconds and they immediately hold their neck. This is called as the universal choking sign because they can't communicate. And they would just hold their neck and, they become all purple. No voice would come. Because for voice to come, you need to exchange air through the windpipe. Okay. And if that doesn't happen, there is no voice. So we need to recognize a child or an adult who's choking. It can happen in a restaurant. It can happen at home, anywhere. The vulnerable population is little children and older people because their reflexes are still not very well developed. However, any of us can choke. We have seen people, we have lost even celebrities, having this choking. So what is the first thing to do? To recognize the universal sign, immediately call for help, and you have to perform the choking relief maneuver. Now that is called as Heimlich maneuver. Basically what you do is, the concept of it is you encircle the person's chest.
You hold it.
Yeah. It's not just chest, it's between the belly button and the chest bone. You hold the person from behind and you make a little fist, and with the other hand you kind of press the soft part of their abdomen between the belly button and the chest bone. Yes. And you put all your force and thrust it backwards and upwards. So when you do that, so when you actually press it back, the pressure kind of expels the bolus of food outside. So you stand behind the patient or the person who's choking and give them these thrusts, which are called as the Heimlich maneuver, and they would just flop out, and the person may
The
expel
obstruction
that.
gets out.
Correct. If it's a child, you are very tall and the child is very small, so kneel down behind the child, and you can do that maneuver. And if it's a small baby, like an infant, infants can suddenly choke.
Correct.
Let's say the brother or the sister put something and
Yes,
the
yes.
child choked. They can't even do the universal sign. So you can see them that they are not breathing and they are making that kind of noise. You immediately pick them up, turn them upside down, put them on your arm, outstretched arm, and give them back blows between their, so the wings, the scapular bones, as we say. You
Shoulder
give them
bones.
shoulder bones. You give them nice back blows, about 5 back blows. The bolus of food may fall. Turn them back and give chest compression. Although I would like to speak about it, these are skills which are very important, and it has to be learned on a one-on-one basis. And that's why it's important that wherever you are, in whichever organization, if you get a chance to attend a basic life support course, I think you really must do it, because it's a skill that we all need and we all owe it.
Yes. The information what you've given is just incredible, ma'am. And before we wrap up, what is one thing or one message you want to give it to our listeners? Maybe let it be for the lifestyle of the kids, lifestyle of the adults, or probably for the first aid. What they have to do, and what is the preliminary thing what they have to remember by themselves?
Okay. So I would like to say that first aid is not rocket science. It is something, it's an essential life skill which all of us can equip, starting from school age children. We need to just get formal training in that, and we should never lose an opportunity to get trained and to offer first aid to anybody. That's being responsible citizens of our country.
Yeah, in case if any common man or a common person wants to learn some emergency skills, where do they go and where can they learn, basically? Just few tips from your side.
So right now, many corporates are doing them in their own companies based on requests. We do a lot of it from our hospital to all our surrounding neighborhood as part of our Community Connect services. The Indian Academy of Pediatrics has excellent videos put up by our national body on how these skills are to be performed. We do mass CPR awareness. In fact, July is our CPR awareness month. So I'm very glad that we're actually doing this on Doctor's Day.
We are talking about the right thing at a right time and on a Doctor's Day.
Yes, absolutely. So I'm very privileged to be talking about this subject. So there are lots of avenues in which we can learn. They have even brought a mobile module of the CPR. So we can just type in CPR IAP or Indian Academy of Pediatrics and we'll get lots of knowledge.
Okay, that's very informative and definitely interesting. So thank you so much for sharing your expertise with us, and thank you for being there today with us. And we hope to do and share a lot of information like this with our audience very soon.
Thank you so much. My privilege on this special Doctor's Day that I got this opportunity. Thanks, Chetan and Vaidya.
Thank you for your SETME venture, and please educate more and more schools and send information through all the educational institutions.
Thank you. Thanks a lot.